Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Listen carefully. When we talk about anger control, do not begin with the idea that anger is only a character flaw. Begin with the body. Begin with the nervous system. Begin with the question, why does a person sometimes react before thinking, speak before choosing, explode before understanding? Anger often feels moral, personal, and emotional, but underneath it, there is also electricity, chemistry, sleep quality, blood sugar, hormones, muscle tension, and brain excitability. So ask yourself, how calm can the mind be if the nervous system is running on a biochemical shortage? How patient can a person remain if their brain is primed toward overreaction? Today, focus on magnesium, not as a magic cure, not as a replacement for therapy, communication skills, prayer, self-reflection, or medical care, but as a powerful biological support for emotional control. Treat it as one part of a larger anger control system. Sleep, nutrition, movement, breathing, boundaries, and psychological work. Here is the key idea. Magnesium helps the body move from a state of internal threat readiness toward a state where the brain can pause, evaluate, and choose. That pause is everything. In anger control, the victory is often not never feeling anger. The victory is creating a few extra seconds between the trigger and the reaction. Why magnesium? Because magnesium participates in hundreds of enzymatic reactions, supports nerve conduction, muscle relaxation, neurotransmission, and cardiac rhythm. And most magnesium is stored inside cells or bone, which means a simple blood test may not always tell the whole story. The NIH Office of Dietary Supplements notes that adult recommended intakes are generally about 310, 420 milligrams per day depending on sex and life stage, and that many people in the United States consume less than recommended amounts from food. So do this. Stop thinking of anger only as a loud emotion. Start thinking of it as a signal from an overloaded system. Then ask, what would happen if we lowered the biological volume before trying to control the behavior? First, understand the nerve-calming role of magnesium. Your brain is not just thinking, it is firing. Neurons communicate through electrical and chemical signals. Some signals excite, some signals restrain. When excitation dominates, the person becomes more reactive. Faster heartbeat, tighter jaw, sharper voice, less patience, less perspective. Why? Because the brain begins to interpret inconvenience as threat. Magnesium helps regulate this excitability. One of its most important roles involves the NMDA receptor, a glutamate receptor involved in excitation, learning, and stress responsiveness. Think of glutamate as an accelerator. You need it. Without it, the brain cannot function properly. But if the accelerator is pressed too hard for too long, irritation rises, sleep worsens, and small problems feel large. Magnesium acts partly like a gatekeeper in this system, helping prevent excessive stimulation. Reviews of magnesium and stress describe its interaction with glutamatergic, GABAergic, serotonergic, adrenergic, and HPA axis pathways, the same biological territory involved in stress, arousal, and emotional regulation. Now ask, how does this connect to anger? Anger becomes harder to control when the brain's alarm system is too sensitive. If the body is tense, if sleep is broken, if stress hormones are elevated, if the muscles are tight, if the heart is racing, the mind has less room to be wise. Magnesium may help by reducing the background intensity of the system. It does not make you passive, it helps you become less hijacked. So give this command to yourself. Before you judge your anger, examine your physiology. Second, look at deficiency signs. Low magnesium is not always dramatic at first. It may appear as fatigue, weakness, muscle tension, tremors, cramps, poor sleep, palpitations, or a feeling of being wired but tired. In more significant deficiency, medical references describe neuromuscular hyperexcitability as a common early manifestation, and neuropsychiatric features can include agitation, depression, delirium, and other severe symptoms. That does not mean every angry person is magnesium deficient. Be precise. It means magnesium status is one biological factor worth considering, especially when irritability comes with muscle tension, poor sleep, high stress, alcohol use, gastrointestinal problems, diuretic use, or proton pump inhibitor use. Ask the practical question: how many people try to control anger at the level of words while ignoring the body that produces the emotional pressure? Imagine someone who sleeps 5 hours, drinks too much coffee, skips mineral-rich foods, carries chronic stress, and then says, "Why am I snapping at everyone?" The answer may not be only psychological, it may also be metabolic. It may be the nervous system asking for restoration. So do this. Track your anger episodes. Do not only write, "I got angry." Write what happened before. Sleep, food, caffeine, alcohol, stress, muscle tension, and time of day. Then ask, was this anger or was this depletion speaking through anger? Third, examine the evidence. The evidence for magnesium and emotional control is not perfect, and you should respect that. Do not exaggerate. Do not promise that magnesium will erase anger. Instead, say it correctly. Magnesium supplementation has shown signals of benefit in stress and anxiety-related outcomes, especially in people with stress, low magnesium status, or vulnerability to deficiency, but stronger trials are still needed. A systematic review on magnesium supplementation for subjective anxiety and stress found suggestive evidence that magnesium may help some people with anxiety or stress symptoms, while also emphasizing limitations in study quality and the need for better randomized trials. That is important. The literature is not saying this is a guaranteed anger treatment. It is saying there is a plausible biological mechanism and enough human evidence to take it seriously, especially as part of a broader plan. Now consider a clinical trial that is especially relevant to anger control because stress is often the fuel beneath anger. In an 8-week randomized trial of healthy adults with low magnesemia and severe or extremely severe subjective stress, participants received magnesium alone or magnesium plus vitamin B6. The magnesium dose was 300 milligrams per day, and the magnesium plus B6 group showed greater benefit in the subgroup with severe stress. Post-hoc analyses also explored mental health and quality of life outcomes. Why does stress matter so much? Because anger is often stress wearing armor. Many people do not say, "I am overwhelmed." They say, "Leave me alone." They do not say, "I feel powerless." They say, "You never listen." They do not say, "My nervous system is exhausted." They shout. So ask, how can magnesium help anger if it is studied more often in stress and anxiety than anger directly? Here is the bridge. Anger control depends on lowering arousal, improving sleep, reducing muscle tension, and supporting the brain's inhibitory systems. Magnesium touches those systems. The anger may be the visible flame. Stress physiology may be the hidden gas line. Fourth, use magnesium in a practical, disciplined way. Start with food. Do not run first to capsules. Build the foundation. Add pumpkin seeds, chia seeds, almonds, cashews, spinach, black beans, edamame, whole grains, yogurt, avocado, and mineral water if appropriate. The NIH lists leafy greens, legumes, nuts, seeds, and whole grains as good magnesium sources, and also notes that refining grains can lower magnesium content. Make this simple. Put 1 magnesium-rich food into breakfast, 1 into lunch, and 1 into dinner. Do not make it complicated. Add spinach to eggs. Add black beans to a bowl. Add pumpkin seeds to yogurt. Use almonds instead of a processed snack. Let the plate become part of anger management. Then, if supplementation is appropriate, choose carefully. Read the label. Look for elemental magnesium, not just the total compound weight. Magnesium glycinate is often chosen for tolerability. Citrate may be useful but can loosen stool. Oxide is common but generally less well absorbed. The NIH notes that forms dissolving well in liquid, including citrate, lactate, chloride, and aspartate, tend to have higher bioavailability than oxide and sulfate. Now give yourself strict instructions. Start low, go slow, and observe. Do not take large doses because you are desperate to become calm by tomorrow. Emotional regulation is not a race. Try a modest dose, often in the evening, and monitor sleep, digestion, mood, and next day steadiness. If diarrhea appears, reduce the dose or change the form. If you feel worse, stop and reassess. Also be medically responsible. People with kidney disease, significant heart rhythm problems, severe weakness, very low blood pressure, or complex medication regimens should speak with a clinician before supplementing. Magnesium can interact with certain antibiotics, bisphosphonates, thyroid medication timing, diuretics, and other treatments. The tolerable upper intake level for supplemental magnesium in adults is commonly listed as 350 milligrams per day from supplements, not counting food magnesium, mainly because higher supplemental intakes can cause adverse gastrointestinal effects and, in vulnerable people, more serious issues. Ask this out loud. How do I know magnesium is helping? Look for quieter signals. Are you sleeping deeper? Are you waking with less tension? Is your jaw less clenched? Are you pausing before answering? Are you recovering faster after conflict? Are you less reactive to noise, delay, criticism, or disrespect? Do not only measure anger by whether you got angry. Measure it by how quickly you return to yourself. Fifth, connect magnesium with the anger control moment itself. When anger rises, do not say, "Magnesium, save me." That is not how this works. Instead, build a body that is easier to calm before the trigger arrives. Then, when the trigger comes, use a protocol. Do this. Pause. Put both feet on the floor. Relax the tongue from the roof of the mouth. Drop the shoulders. Exhale longer than you inhale. Ask, why am I reacting this strongly? Then ask, how can I respond without creating damage? Magnesium may support the baseline. Breathing controls the acute surge. Language controls the social outcome. Reflection controls the pattern. Use all of them together. Here is the deeper point. Anger control is not suppression. Suppression says, I am not angry while the body is boiling. Control says, I feel anger, but I will not let anger drive. Magnesium may help reduce the boiling pressure. It may give the prefrontal cortex, the part of you that plans, inhibits, and chooses, a better chance to stay online. And ask one more question. What if the most powerful anger strategy is not only learning what to say, but preparing the nervous system so you can say it well? So remember this. Magnesium is not a personality transplant. It is not a sedative for the soul. It is not a license to avoid apology, therapy, accountability, or communication skills. But it may be a valuable ally because anger is not only an emotion, it is also a physiological event. Use magnesium wisely. Eat mineral-rich foods. Check your risk factors. Consider testing and clinical guidance when needed. Supplement carefully if appropriate. Track your sleep, tension, and reactions. Build the pause. Protect the pause. Practice the pause. Why? Because the person who can pause can choose. How? By calming the system before the storm, not only during the storm. Let magnesium become part of a larger discipline. Nourish the body, train the breath, refine the words, repair quickly, and keep becoming safer for the people around you. Take care of yourself and take care of each other. We are learning this together, like a family committed to growing stronger. See you in the next topic.